So what's the biggest health issue you've identified in the Golden Valley?
Well, the Golden Valley has some unique challenges because only 3 hours out of Melbourne, there's still some real workforce challenges getting a full range of providers to come out and live here and meet the needs of the community. But you also have some, as I understand, some refugee and new migrant issues, and they're quite unique to this part of Australia. You don't see that in many areas, and so it's a real added challenge for health providers here.
And how is that a challenge?
Well, first of all, you've got non-English backgrounds. You've got existing services like childcare centres and schools, as well as obviously need to adapt. Australia is a country where we have probably the best or second best health system in the world, but incredibly dispersed population of small communities, and we're trying to get 100% health outcomes in each of them. So we have these issues about how do I access a specialist? How can I make sure that I can follow up patients that live remotely? And then you have all of the farming and rural health challenges overlaying. You've got an Indigenous population as well. So as far as health goes, it's probably one of those challenging areas at the moment.
Yeah. What were the main health issues raised today in the forum?
Well, the main issue,
this region.
Of course, and for the main issue for a community like Shepparton, where when you step back and look nationally, you think it's fairly close to Melbourne. The main issue here is that it isn't that easy to attract health specialists to move here, or allied health providers in particular. The private health issue is that the harder we make it for Australians to keep private health, the more they will drop their extras cover, and that will make it increasingly hard to attract allied health providers here. And a physiotherapist has no private practice because everyone is trying to contain private health increases that the Labor government is obviously inflicting on local communities, then that will undermine your health provision. And then lastly, with Indigenous health, we need to be reaching out to those services and make sure that they serve all Indigenous Australians. And in fact, Indigenous health services need to have an open door to all Australians, not just Indigenous Australians, because we ask the same of our hospitals, that they treat and see all Australians.
Going back to keeping sort of doctors and specialists in the region, recently we've lost 2 obstetricians at the hospital and haven't replaced them just yet. How can we retain and attract specialists and doctors to the region?
Well, there's already a large range of incentives to bring doctors out, but it doesn't guarantee that you'll get them. Simply handing a regional city like Shepparton a bag of money to go and hunt for a doctor often isn't successful. And it's just not good enough for cities to say we've done all we can. So I would argue that we need to have more telehealth so that local patients here don't have to travel to Melbourne just to do a 15-minute checkup. And at the same token, we need to have direct connections to these specialists so that they can give advice using the internet. So that they actually build the skills of local providers as well. Obviously, you'll always need an obstetrician or 2 more here in Shepparton, and that's a training issue, but it's also allowing specialist trainees to come to regional areas and do their training here and have it accredited and have it count towards their progress. Because in many cases, you come to a place like this, Shepparton won't recognise your training if they don't have enough specialists here. So it's a mutually reinforcing circle, and we've got to break that by allowing places in Shepparton for students and trainees to be accredited.
And does that come down to funding for these?
It does.
For these training?
That's right. Increasingly, state and federal governments are acknowledging that a real deficit at the moment are funding of these positions. And if we want to fix these problems, I think you'll find increasingly governments will be doing that.
Again, with the hospital, they've been in line for redevelopment for quite some time, quite a number of years. Is that a state-funded thing, or does the state apply federally for that money, and how does that work?
Look, it's overwhelmingly state-funded, but in many cases the federal government is stepping in and providing matching funds, which tends to stimulate states to give more money. But at the same time, you're seeing the federal government introducing a carbon tax this week, which will be hitting every treatment bed, every hospital bed in Victoria to the tune of $2,000 a year. Now, where are local hospitals going to find $2,000 that they don't take out of local services and outreach? And we think it's an outrage that you charge a carbon tax on a hospital, but Julie Gillard's given no concessions there, so you'll be seeing fewer health services and you'll see higher carbon tax bills for hospitals. It increases every year. Today's just the start.
How could the opposition sort of support the redevelopment?
Well, our view would be that in regional areas where additional investment is needed, that's something we have a discussion with states. The federal government's main job is making sure you've got staff to be in those corridors and those hospital treatment rooms, because building Taj Mahals without any staff is utterly pointless. Again, we've seen Labor building super clinics where the building goes up, but they simply are pinching staff from neighbouring general practices, and that doesn't help anyone.
Another issue for Shepparton in particular in the region is our mental health funding and services, and in particular youth mental health services. Has the opposition identified this as an issue, and what support could you give for that?
Look, this is one area where most Australians would agree that the opposition was first there with a really comprehensive mental health plan, and we really had to shame Mr Rudd and then subsequently Prime Minister Gillard into coming up in 2010 with a matching proposal, which on the surface of it had an equal amount of money, but we're just seeing that it's not landing. And in a place like Shepparton, to have the federal government give you $50,000 for mental health, you can't even employ a person for that amount of money, then the money's not used at all. So we want to see rolling out of the headspace centres and the EPIC models. There's bipartisan agreement at that level, but really what this government is focused on are more so community psychological services which are publicly funded, and of course at 5 o'clock when those people go home, the pressure's back on the GP. He's got to do the after hours but doesn't know the patient. So certainly the coalition is very strong on a GP-centred model, because these are the front line of our services in regional Victoria, and they offer the 24-hour support, and they need to therefore be supported to do it.
So how would that GP model work?
Well, that's how it already works. So a GP knows the patient and then is able to refer them for up to 10 or 12 visits per year to see people like an allied health provider, a psychologist in particular. Labor cut that back, and they said you can have fewer visits, and that was a very regressive step.
Okay, great. Thank you very much.
It's a pleasure. Great.